Good evening, everyone, and thank you so much for joining me again. Tonight is my 30th live event. I can't believe it is 30 days that I have been doing the live events. And tonight I'm going to discuss a topic that is somewhat a difficult topic to discuss, but I feel very important as we address pregnancy and the many decisions that women are faced regarding procedures for pregnancy. I'm going to talk about abortion, and let me just bring up slides one more time. The slides keep me on track and keep me focused to what I want to present. And I would ask that if you have any questions or comments that you feel certain to put them in the chat box. I will also leave my email address in the description. So when you come back to look at this video again, you'll be able to contact me regarding further questions or comments that you might have. I didn't introduce myself. I'm Carolyn Curtis. I'm the CEO and founder of the CARAB Company. So why am I addressing this topic? I have worked in this space in regard to working with abortion for over 20 years, working with post-abortion care, and also have cared for many women who have undergone abortion and with another pregnancy sometimes may experience some complications. And what I found interesting is without fail, women would say, I wonder if God is trying to punish me for the abortion that I had. So why am I doing this presentation tonight? Because I really care for women. I want to understand the root causes for abortion. I want to know women to know, and not just women, but the world to know that many women find themselves with unintended pregnancy due to sexual abuse. It's not always, I've gone out on Friday night and I'm going to go on Monday and have an abortion. And I feel that people need to understand that this is not a decision that women make lightly, nor is it usually their first decision when they find themselves with a pregnancy that they did not intend. There's a lot of psychological reactions to abortion. For women prior to the procedure, there might be quite a lot of anxiety and distress, but we also know from the literature that after the abortion has happened, there's a sense of relief for a lot of women. Also, there are some who may have some feelings of depression and anxiety that can last up to 2 years. It's not something that's going to cause a woman to throw herself off the cliff. This is not that type of reaction. I want to have realistic expectations and realistic conversation regarding this topic. However, because of what happens in our society, the religious institutions that we may have been brought up in, family expectations, that women, once they've had an abortion, may leave that incident with long-term feelings of guilt and shame that they cannot seem to get over. And I want these women to know that God forgives you, that this is not an unforgivable sin, that God forgives you, and that in times we need to get further counseling to help bring healing. And this is one reason why I want to bring this, is to let women know and understand that. And I also say that the question or decision around abortion is sometimes thrust upon women when they never plan to even entertain this. And when I go through some of the slides tonight, you will begin to see why I'm going to say this. When we talked last week with one of our dads who talked about when his fiance became pregnant, she was approached with the question of, did she want to abort? That was not her question. That was the question provided to her by the provider. So as we go through the slides, I want to just bring this information to bear. So I'm looking at 2020, which is the most latest data that we have from the Centers for Disease Control. And as you look at the abortion rates, there were in 2020 over 620,000 abortions performed in the United States. Keep in mind that not every state is reporting. I think we're looking at about, I have to go back and double check. It's not all 50 states which this report is from. So this is likely an underreporting of the number of abortions that did occur. When you look at that, whites have the least number of abortions per 1,000 women. But what's marked is to see that with blacks, that they are getting abortions at twice that of the Hispanic race, and also 4 times that, almost 4 times that of whites. Most abortions are happening for women who are in their 20s and 30s. That's where most of the abortions are occurring, approximately 88%. But it's important to know that married women are also getting abortions, and we don't think about that. Married women also are receiving abortions at almost 14%. The root cause for abortion is unintended or unplanned pregnancy. This is the world over. We know this. And for those women in the United States who do not want to become pregnant and not using a contraceptive method for many reasons, and we can chat about those reasons, 27% of those women are Black, 21% are Hispanic, and 13% are white. Some of those reasons for not using a contraceptive method are people continue to have concerns about side effects. For some, the cost of the contraception, that for the contraceptive method they want to use, their insurance may not cover it fully. Also, access to contraception. That is another reason why it's not being used. What I find, I'm going to move my picture out of the way on this one. Oh, wow. So I'm bringing up this slide. Let me do this again because this is an important slide. I bring up this slide to say, as we look at abortion among people of color, I'm a little bit appalled, and I think we all should be, in terms of the rate of abortion in particular states throughout the United States. And I also find it a bit appalling that we have 9 states in which we're talking over 40% of the abortions for that state are occurring in Black people. And when you look at Hispanics, we're looking at only 1 state where the abortion rate for Hispanics is over 50%, and only 1 state of 40%. The others are under 40%. What this says to me is that if I am a person of color living in these states, that the likelihood of me being approached with the question of, do I want to have an abortion, is probably going to be quite high. In Mississippi, 77.3%, 3/4 of the abortions occurring in that state are occurring on Black people. In Georgia, 66.5% Black people. Alabama, 66.1%. Arkansas, 54.5%. Michigan, 54.4%. North Carolina, 52.3%. Delaware, 46.7%. These numbers make me want to ask some serious questions. Do we actually have this number and percentage of women who are coming forth when they have a pregnancy test stating that they want to have an abortion? Or is this something that is introduced to them in terms of pregnancy options available? Question to be asked. I'm just throwing that out there. I bring this up. We probably haven't known very much that women go through many psychological changes during pregnancy. I studied this a lot and did a paper on this when I was in grad school, looking at the developmental tasks of pregnancy. And these are 4 tasks that are interdependent. They depend on one to the other. For one to happen, the other needs to be occurring or completed. But the one that stands out in regard to decision around abortion is acceptance of the child by the significant other, meaning that if this pregnancy is not acceptable by the father or even a close family member of the mother, that it will likely end up with an abortion. The other is the whole idea of ensuring safe passage for mother and child, meaning, is there enough support systems around the mother that she feels that she's able to accomplish this pregnancy without difficulty, that there's enough support system, whether it's social support, family support. These are very, very important. Those are two developmental tasks that are very prominent and very important. But the one that if it is not completed, where there is acceptance of the child or the pregnancy by the significant other, if that is not completed, the pregnancy will not continue. We talked earlier last week, we spent a lot of time on informed consent. What is supposed to be involved with informed consent? We spent time a couple of nights ago talking about what happens when we sign forms for pre-admission into hospital for informed consent, wanting to make sure that there has been conversation around the proposed intervention, that you're understanding the diagnosis, the surgical procedure, or the medical procedure that will go on, that there's been some sort of negotiation where there's been time to ask questions and time for reflection, and that there can be questions and debate between the patient and the provider. And the other things that we talked about is that these sorts of elements need to happen in informed consent, that there's an illness or an injury, that there has been developmental of some sort of a treatment relationship with a provider. A history and physical exam has been done, treatment or test recommendations have been provided, and there has been the disclosure of pertinent information. I'm going to say this again in relationship to abortion, the disclosure of pertinent information. In my work, I find that that disclosure of pertinent information may or may not have occurred for that mother to be able to make definitely informed consent related to the procedure, and that there has been enough time to have an exchange of questions and answers, and then some agreement related to what will be done. There's much discussion in our country now after the overturn of Roe versus Wade in regard to, availability of abortion, telehealth and abortion, all of these sorts of things. I want to bring back to play informed consent, and is informed consent being adhered to related to abortion. So some of this that I'm going to go through purposefully a little bit more information than what I have done in previous things that I've talked about, although I did go through a consent form looking at pre-admission. So I've already got that ahead of me. It's important that women understand the different types of abortion and that they understand the side effects related to the abortion. Medical abortion is generally done up until 12 weeks. Well, actually, up until 10 weeks. It's only effective up until 70 days conception, which would be about 10 weeks. Those medical abortion, we hear the abortion pill is mifepristone, misoprostol. Uterine installation is more when there was saline abortion occurring, which does not occur very much anymore. And vaginal prostaglandins, and what they do is to help cause the cervix to be opened up and cause contractions to happen. The side effects that women need to know about, because when medical abortion is happening, you're doing this at home by yourself or with a friend. You're not in a hospital surrounded by hospital personnel to provide support to you for the most time. So you must know that this is not once you take a pill that everything is going to happen, that this is something that can take 7 days and sometimes longer for a full evacuation or emptying of the uterus to occur. Some of the things that can be experienced is nausea and vomiting, headaches, diarrhea, fever, chills, flushes, sweats. It's very possible that the abortion may not be totally effective. And so what you end up is with retained tissue in the uterus. You can have excessive bleeding, infection because of that retained tissue. And if you were to continue the pregnancy, when misoprostol is used, you run some risk of congenital anomalies if you were to continue the pregnancy after attempting abortion with misoprostol. The other thing that we don't hear a whole lot about is Rh factor. We have our blood types. We are like a blood type A, and then it's the Rh negative or positive. Rh factor is very important because you can be sensitized to the Rh factor, which then for the next pregnancy can have some major implications in regard to morbidity and death in successive pregnancy of that baby. So it's something to know about. So again, this is not something that you do by yourself without a provider being involved. Due to the Rh is one big thing. And we talked about psychological sequelae, that you can experience some depression and anxiety after the procedure is done. Now, surgical abortion, and this is going to be happening after the 10 weeks and up. Different types of surgical abortion include the dilatation and curettage, or what's known as sharp curettage, the dilatation and evacuation. You're going to say, what does all this stuff mean? Basically, what it means is that the cervix needs to be opened and dilated to be able to allow an instrument that has a suctioning effect inside of the uterus. And either the uterus is suctioned out, which is known as evacuation or manual vacuum aspiration, or curettage is with a sharp instrument. The side effects of that can include infection. Infection, if it's not treated, can put you into shock, septic shock. There can be tears to the cervix or lacerations to the opening of the uterus. The uterus itself can get a hole punched through it, perforation. There can be hemorrhage. There can also be injury to the bladder or to the bowels. Once again, it can be a failed abortion, and that would be situations where you have an ectopic pregnancy. Ectopic pregnancy being when the pregnancy is in the tubes and not in the uterus. Some of the tissue, again, can be retained, as we talked about earlier. There can be some adverse reactions to medications. When the cervix has been dilated, there is possibility that with future pregnancies, the cervix is a muscle. And in labor, the contractions naturally cause that muscle to thin out and to open up. But when you have abortion that's done with dilating the cervix, it's an artificial opening of that cervix. And it may not close down totally. And so with the next pregnancy, it's possible that the cervix can open up before its time and you can then miscarry. And so if you have a history of abortion with using D&C or D&E, it's very important with your pregnancy, when you're planning your next pregnancy, to have an ultrasound done early to be able to check the length of the cervix to make sure it's good, okay? There can be ectopic pregnancy, which we talked about, pregnancy in the tubes, which will not be taken care of if you have a D&E or D&C done. And there's a thing called disseminated intravascular coagulation. This is a very, very dangerous situation. This happens when there has been infection. What can occur is that it just throws off all of your blood clotting factors, and you can really just bleed. And you can also die from legal abortion. In 2020, there were 4 deaths in the United States from legal abortion. The part that I think women do not get information around, and this information is all over the internet if you want to find it. And I will say that it is our responsibility in terms of knowing ourselves to be able to know and to understand everything that's going on. When you go in to have treatment for any sort of, let's say we're having a surgery done due to, let's say we have a breast cancer, okay? And you want to know what is that tissue. We do all of this to find out what is that tissue. We type the tissue. We do all this to make decisions around what type of treatment is best. But we tend to not find out information to that degree when it comes to fetal growth and development. And so I have included that information. This information you can find online, Cleveland Clinic. You can find it word for word. I'll even include that in my description, and I have it also on the slide. I wanted to provide information on what's going on with fetal growth and development up until 12 weeks, because we know that most abortions are occurring up until 12 weeks. Did you have any idea when the heart begins beating? Any idea at all? The heart begins beating at 42 days. 42 days after conception. In week 5, we have the beginnings of the brain, the spinal cord, and other neurons for the central nervous system is laid down, okay? The heart is beating. In week 6, the arms and legs have begun to develop. Blood cells are taking shape, and circulation, the blood circulation will be beginning. The structures that are for the eyes, the ears, and the mouth have begun to take form. And if you had a vaginal sonogram done, where they place a probe into the vagina to look at the pregnant uterus, you would be able to see a heartbeat at that point. In week 7, the bones have begun replacing soft cartilage, and the genitals have started forming. Week 8, all of the major organs and the body systems are developing. The eyes become visible, the ears begin to form. The umbilical cord is fully developed, and it's transporting oxygen and blood to the embryo. Week 9 to 12, the teeth, the taste buds are forming, muscles are forming, the body shape takes on more of a human appearance. And if I were to see you in the office, I could hear the baby's heart rate with a dop tone, or with a dop tone listening. The arms, the hands, the fingers, the toes are fully formed. Fingernails and toenails are beginning to develop. The external ears have formed. The external genitalia has begun to form, but you still can't see it on sonogram because at this point, the fetus is still quite small in size. Week 11, the fetus is exploring by doing things like opening and closing its fists and its mouth, its knees, its elbows, its ankles are working. But because of the size of the fetus, you're not able to feel kicks at this time. The bones are hardening by week 11. The skin is still very transparent, but the facial features are more prominent. By week 12, all of the organs, the limbs, the bones, the muscles are present and will continue to develop to become fully functional. The circulatory system, the digestive system, the urinary system is working. The liver is producing bile. At 12 weeks, the fetus is drinking and peeing. So this is what's occurring with fetal growth and development up until 12 weeks. And why is that important? Because this is important information to know in regard to informed consent. So let me remove this. So this is the information that I've provided related to informed consent. In summary, that it's important that when you are going for prenatal testing, it's quite possible that you may be encountered with the question of So what do you want to do with your pregnancy? Do you want to abort or not? And as you make those decisions regarding what you plan to do for your pregnancy, that you have full information to be able to make an informed consent. That information is going to include fetal growth and development. It's going to include the type of procedure, how far pregnant are you at the time, the side effects, and also all of the implications for yourself. So these are all of the things to consider. Once again, thank you for your time. I appreciate your listening to me during my 30 days challenge. I will plan to come back probably in another week with another topic. We may get into informed consent around sexual activity and sexuality. So if you have liked what I have shared with you tonight, please feel free to like my page, to subscribe to my channel. Also, tell your mom, your dad, your sisters, your brothers, your aunts, your uncles, your cousins, and your friends. Thank you again. I will be coming out with an ebook soon, so watch for me. You can reach me by email to provide comments, to provide any information on further topics that you'd like to hear at cabcurtis@thecarabcompany.com. Thank you so much, and I appreciate your time. Have a good evening. Bye-bye.